In this video, we will be beginning with developmental disturbance of lips and palate. We have also posted various other developmental disturbances also in oral pathology. Do check out the other videos and subscribe to the channel. So coming to the first developmental disturbance of lips and palate, it is congenital lip and commissural pits and fistulas. So as usual, we will try to figure out the pathology from the name. So first word given is congenital, that is this is present during the time of birth. Then lips, this is known to affect the lip region. Then commissural, commissural is the corner of the mouth. Then we can see it is affecting the lip and also the commissural of the mouth, the corner of the mouth, and it is something congenital. So what is happening is you can see pits and fistulas in the lips or commissurals. What is pits? Pits means a small cavity or small hole or small pit. Like what we see in the tooth. We see there is a pit in the tooth, the cavity, which is a small hole which we can see in the lip. Fistula. Fistula means what? A connection between two parts. Abnormal opening between two parts. Here also there is some pits and fistulas which we are seeing in the lip, and it is also congenital. So this topic we will be seeing under the headings Introduction, Pathogenesis, then types of lip pits and fistulas, clinical features, and finally treatment. So coming to the introduction, the case was initially reported long back in 1845 by Quay. So as the name shows, it is a congenital disorder, and most of the cases they will have a familial inheritance. They will be inherited in a dominant Mendelian pattern. So they are inherited on autosomally dominant pattern. And you can see in most of the cases, that is about 75 to 80% of the cases, the patient is not only going to have pits and fistulas, but they can be associated with cleft lip or cleft palate, and in some cases both cleft lip and cleft palate can be seen. So that time when these pits of the lip, pits of lower lip, that is pits of lower lip and your cleft lip or cleft palate or both is associated, then it is known as Woude syndrome. Woude syndrome is our next video in developmental disturbance of lips, which I will be discussing about Woude syndrome in detail. Next, coming to the pathogenesis. So what is occurring really is there is some defect which is occurring during the development time where there is no proper fusion occurring. That is what happening. So if you consider the normal development around 5 to 6 weeks or around 5.5 weeks of time, your sulcus lateralis of your lower lip and your maxillary arch, this will fuse, and also your maxillary and nasal processes also fuse around 6 weeks. Around this time, all the maxillary process, nasal process, and maxillary process and lower lip lateral sulcus all are fusing properly. But this time, what happens is on the 5 to 6 week of time, some disruption is occurring and there is no proper fusion which is occurring in both places. So when there is no proper fusion occurring, that's the time it's not only resulting to pits in the lips, it may also lead to cleft lip or cleft palate. That is the crucial time where your pits and your cleft lip, cleft palate are occurring together. So what happens here is there is failure of complete union of your embryonic lateral sulci. Okay, this line itself will explain. So the lateral sulci of the lip usually have to be completely fusing. When there is no proper fusion happening, then this can lead to some lip pits. Next, coming to the types. So based on the location, there are 3 types. Commissural pits, that is the pits occurring in the angle of the mouth, that is the corner of the mouth. Second, midline sinus of upper lip. When the pit is in the upper lip, it is called as midline sinus of upper lip. When it is affecting the lower lip, we call it as congenital sinus of lower lip. And also remember, lower lip, most of the cases it is going to affect the vermilion border of lower lip, which are explained in the clinical features again. So coming to clinical feature. So age we already know, it's gonna be occurring at the time of birth itself. Then coming to the gender, females have high chance of inheriting the pathology. Now coming to the location, in the lips, you know it is going to occur in the commissures, and also most of the time, as I have told, it is going to affect the vermilion border of the lower lip. Lower lip vermilion border is having high chance of getting affected. Most of the cases are like, there will be bilateral pits in the vermilion border of lower lip. These are most of the cases which has been reported. I will be adding pictures for references. But there has been also cases which has been reported which are unilateral. Even there are cases which mostly they are affecting the corner of the mouth also, they can be affected bilaterally. Some cases can also be unilateral. And in some cases, this pits can have some mucus secretion that will be coming from the base of the pit. In some cases, the lips may be swollen, which will be sometimes causing some discomfort to the patient. Now, when the pits, they are not only pits, when there is an actual fistula, what happens is sometimes we can see there will be some fluids which are coming out. So, whether there is an actual fistula, whether there is a true duct or something, it's not still clear. In several cases, there has been seen that there is pre-auricular pits in patients who have commissural pits. When the patients have commissural pits, it has also been seen the patients also have pre-auricular pits. What is pre-auricular? Auricular is ear. That is in front of the ear region, they may have some pits. It's one interesting finding. Now coming to the treatment, it's not going to give you any functional issues or anything, and it's not going to be a major issue in most of the cases. But when there is a swelling or when it's going to be an issue for patients, and when the patient needs a cosmetic treatment, then we can go for surgical excision. Mostly it is done for cosmetic reasons. So that's all about lip pits and fistulas. I hope you have understood the concept. See you again in another video in another topic. Thank you so much.